This is our presentation on Parkinson's disease. My name is Stephanie Wilkinson, and I am a post-baccalaureate student who is pursuing a degree in biology. I work as a speech-language pathologist with children who have speech, language, and hearing disorders, and I love to read and travel.
Hi, my name is Tiara Jessup, and I am a junior public health major. I enjoy reading, traveling, and making people smile. My passions are children and maternal women.
My name is Alexander Harrington. I am a junior majoring in public health. I enjoy reading various books and doing crafts from Pinterest. There is no exact pinpoint when Parkinson's disease was first discovered. James Parkinson was the first person noted to research Parkinson's disease. He received no help from his colleagues because in 1817, Parkinson's disease was not a focus disease. From James Parkinson's essay, Jean Martin Charcot and his colleagues researched Parkinson's disease in deeper depth. This paved the way for future research on Parkinson's disease. There are different factors that play a part in Parkinson's disease. This study researched how race, age, work environment affects an individual's likelihood of Parkinson's disease. As age increases, probability also increases. Work environment can also increase chances. Environments with pesticides and heavy metals had strong correlations.
Etiology. Parkinson's disease is an age-related neurodegenerative disorder that affects approximately 1 million persons in the United States. It is characterized by resting tremor, rigidity, bradykinesia or slowness, gait disturbance, and postural instability. The specific cause of Parkinson's disease is not known, but there are many factors that contribute to the etiology. Some are environmental and some are genetic. An example of an environmental factor would be exposure to well water. Oxidative stress is a part of the pathogenesis of Parkinson's disease. Diagnosis. Contrary to other illnesses, there is no specific test to diagnose Parkinson's. Because of the close similarity in symptoms Parkinson's has with other neurological disorders, it is difficult to accurately diagnose. However, a diagnosis is made by a physician based on family history, review of signs and symptoms, physical exams, and a neurological exam. There are 4 main symptoms: shaking or tremor, slowness of movement, rigidity of arms, legs, and/or trunk, and trouble with balance. In order to diagnose, a patient must have 2 of the 4 main symptoms. The following slides continue to talk about diagnosis and the DAT scan imaging.
The following slides discuss medical treatment. Currently, there is no cure for Parkinson's disease, but there are drug therapies to help manage symptoms. Depending on the progression of Parkinson's disease, surgical intervention may be necessary.
There are 3 categories that medications for the treatment of Parkinson's disease fall into: drugs that work directly or indirectly to increase the level of dopamine in the brain, drugs attempting to ease symptoms, and drugs that help control the non-motor symptoms of Parkinson's. The following slides go into great detail on drug therapies.
If a patient does not respond to drug therapy, surgery may be necessary. One surgical intervention is DBS, deep brain stimulation. DBS is a device that sends electrical pulses to the patient's brain. DBS helps stabilizes the symptoms.
Usually after a treatment plan is established, patients typically show improvement of their symptoms. The patient must continue to work closely with the team of medical care providers as the disease progresses.
There is no clear set goals in public health due to the fact that there is a substantial amount of research and study being conducted by neurologists, epidemiologists, and other officials in public health settings. Strategies are early detection, diagnosis, and proper treatment.
Healthy People 2020. The goals for Parkinson's disease are to reduce the prevalence and severity of disorders of hearing imbalance, smell and taste, and voice, speech, and language. The objectives are to reduce the proportion of adults with chemosensory smell or taste disorders who as a result have experienced a negative impact on their general health status, work, or quality of life in the past 12 months.
These are the resources used to present this presentation.
Thank you.